What the Study Says.
Welcome back to What the Study Says.
Great to be digging into another topic.
Absolutely. Today, we're tackling something huge: high blood pressure. As physicians, we deal with this constantly. We wanted to really go deep ourselves, so we pulled together a whole stack of research, not just guidelines, but actual studies, meta-analyses.
Yeah, we've been doing our homework, really sifting through the latest on hypertension, specifically looking at diet. What does the research actually say about using food to manage it?
Right. So our goal for you today is to basically cut through all that dense research and pull out the key insights, the stuff you really need to know.
Think of this as getting you straight to the actionable findings on diet and blood pressure based on the studies we've reviewed.
Exactly. We'll start with a quick overview. What is hypertension? Why worry about it? Then spend most of our time on the dietary approaches. We'll definitely cover the DSH diet, but also some pretty surprising results from recent comparisons.
Sounds like a plan. Let's unpack this.
Okay, so basics first. Hypertension.
Right. So as the research lays it out, it's basically just elevated blood pressure. Generally defined in stages. Stage 1, that's a systolic pressure, the top number between 130 and 139, or the diastolic, the bottom number, between 80 and 89.
Okay.
And stage 2 is 140 or higher systolic, or 90 plus on the diastolic.
And getting an accurate reading, it's not always straightforward, is it? The studies mention this quite a bit.
No, it's really not. Office readings are common, obviously, but, things like anxiety can push those numbers up temporarily.
The white coat effect.
Exactly. So the research often points to home monitoring, or even better, ambulatory blood pressure monitoring, ABPM.
That's the one you wear for 24 hours.
Yeah. It gives a much better picture of your pressure during normal daily life, even while you sleep. The guidelines often prefer it for, the initial diagnosis.
Makes sense. And if you are doing home monitoring, there are tips in the research for getting it right, yeah.
Oh, yeah, definitely. Key things are: sit quietly for about 5 minutes first. Feet flat on the floor, back supported, arms supported at heart level.
Okay.
No talking during the measurement. And don't just take one reading, take multiple readings, maybe over a week, morning and evening. Consistency helps smooth out fluctuations.
Got it. So mechanically, what's driving that pressure? Just a quick refresher from the sources.
Sure. Fundamentally, blood pressure comes down to two main things. First, how much blood your heart pumps out per minute, that's cardiac output.
Right.
And second, how much resistance there is in your blood vessels. Systemic vascular resistance.
Output times resistance, basically.
Pretty much. And it's regulated by complex systems like your sympathetic nervous system, hormones like the renin-angiotensin-aldosterone system, RAAS, which manages fluid and vessel tone. It's intricate stuff.
And for most people, it's primary hypertension, meaning no single obvious cause.
Correct. It's usually a mix of factors. The research consistently flags things like, getting older, unfortunately, obesity, or even just weight gain over time. Family history genetics clearly play a role. And insufficient sleep is another one that comes up, often defined as, less than about 7 hours a night consistently.
And the reason we're focusing on this, the reason it matters so much for you, the listener,
it's the risk factor aspect. High blood pressure isn't just a number. It's a major driver of really serious cardiovascular events. We're talking heart attacks, strokes, heart failure.
Yeah, the data is pretty stark. Even what seems like moderately high pressure significantly increases your risk. Treating it is just incredibly impactful for reducing those risks.
Absolutely. And importantly, the first line of defense, recommended for everyone with elevated blood pressure or hypertension, it's lifestyle changes.
Which brings us squarely to diet.
Exactly. The power of food.
Okay, let's get into it. This is where it gets really interesting, I think. How much food choices matter. And the big one that always comes up in the research is the DAH diet.
Right, DASH. Dietary Approaches to Stop Hypertension. It's everywhere in the guidelines, and for good reason, based on the evidence we looked at.
So what's the core of DAH, according to the studies?
It's really about loading up on nutrient-dense foods, lots of fruits, vegetables, whole grains, includes low-fat dairy products.
Okay.
And crucially, it's designed to be low in sodium, low in saturated fat, and low in total fat. The idea is to boost minerals like potassium, magnesium, calcium, which tend to lower pressure while cutting back on things that raise it.
And does it work? What does the evidence say?
Oh yeah, the evidence is solid. We looked at multiple studies, meta-analyses. They consistently show DHH lowers systolic blood pressure quite reliably.
Systolic, the top number.
Right. The effect on diastolic, the bottom number, can be a little more variable in some studies, but the overall BP lowering effect is definitely there, especially, and this is key, in people who already have hypertension.
Okay, so it makes the biggest difference if your pressure is already high.
Seems so. And one of the landmark studies, the original DHH sodium trial, was really revealing.
What did that one find specifically?
Well, it was clever because it didn't just test DASH versus a typical diet. It tested DSH with different sodium levels.
Teasing apart the effect.
Exactly. And the big takeaway was that combining the DSH diet pattern with low sodium intake, specifically targeting under 2,300 milligrams a day, and even better, aiming for around 1,500 milligrams.
I'm pretty low sodium.
It is, but that combination delivered really impressive blood pressure reductions compared to a typical higher sodium diet.
How impressive are we talking?
In that specific trial, the DSH plus lower sodium group saw systolic pressure drop by almost 9 points, like 8.9 millimole Hg, and diastolic by about 4.5 millimole Hg, compared to the control group eating a typical American diet with higher sodium.
Wow, that's significant.
It really is. And the key insight was the synergy. Lowering sodium on top of the DSH pattern gave the biggest benefit. The lower the sodium, the better the result with DSH.
Okay, so DHH plus low sodium is a powerful combo. But science never stands still, right? Did the research look at any variations?
Yeah, this is where it gets kind of intriguing. We found one study that explored a higher fat version of DSH.
Higher fat DH sounds counterintuitive for heart health, maybe.
Right, that's what makes it interesting. They swapped the low-fat dairy for full-fat dairy, and it was also lower in sugary stuff compared to the standard DIASH. The question was, could this still work for blood pressure?
What happened?
The results were pretty surprising, actually. This higher-fat DIASH diet lowered blood pressure just as much as this standard low-fat DIASH diet.
Really? Same BP reduction with more fat.
Yep. But here's the kicker. It also did a better job at reducing triglycerides and VLDL particles. Those are other fats in the blood linked to heart risk. And it didn't significantly raise LDL, the bad cholesterol, compared to the standard DSH.
Huh. So same blood pressure benefit, maybe slightly better on some other lipid markers?
Potentially, yeah. Compared to the control diet, both DSH versions improved lipids, but the higher fat one matched the BP lowering and had those triglyceride benefits versus the standard DSH. It really highlights that maybe the type of fat matters and the overall dietary pattern is key, not just one nutrient like total fat.
That's fascinating. It challenges some old assumptions.
Yeah.
Okay, what else did the research compare?
Well, another really compelling study we looked at put DSH head-to-head against a very low carbohydrate, or VLC diet.
Okay, low carb versus DHH. That's a comparison you hear debated a lot.
Definitely. And this study focused on a very specific high-risk group of people, adults who had hypertension plus either prediabetes or type 2 diabetes, and were also overweight or obese.
So a group with multiple metabolic issues going on. A real challenge.
Exactly. The researchers wanted to see which diet worked better for this specific triple threat scenario, where experts sometimes disagree on the best approach.
Right. So what did this head-to-head trial find over the, 4 months it ran?
The findings were quite striking for this particular group. Over the 4 months, the very low-carb diet led to greater improvements than DHH in several key areas.
Greater improvements. Like what?
Well, systolic blood pressure, for one. The reduction was nearly double on the VLC diet compared to DHH. It was about a 9.8 millimillichit drop with VLC versus about 5.2 millimillichit with DHH.
Wow, almost a 10-point drop versus a 5-point drop. That's a big difference in just 4 months.
It is significant. And it wasn't just blood pressure. The VLC group also saw bigger improvements in blood sugar control measured by HbA1c.
That's the average blood sugar marker.
Right. And they also lost substantially more weight. On average, almost 19 pounds in the VLC diet compared to about 10 pounds on the DHH diet in this study.
Okay, hold on. So for this specific group, high BP, diabetes or prediabetes, overweight VLC beat DSH on blood pressure, blood sugar, and weight loss in this trial.
That's what this particular 4-month study suggests, yes. Now, we absolutely need to add the caveats the researchers themselves pointed out.
Okay, what are the limitations?
It was a relatively small study and pretty short-term, only 4 months. So you need larger, longer trials to really confirm these findings and see if they hold up over time and in broader groups of people.
Right.
And Things like adherence were self-reported, which can be, a bit fuzzy.
Sure, always a challenge in diet studies.
But even with those limitations, the insight is powerful. It strongly suggests that for this specific high-risk population, a very low-carb approach might offer more significant short-term benefits across multiple important health markers compared to the standard DASH diet.
It really drives home the idea of personalized nutrition, doesn't it? That the best diet might really depend on the individual's specific health profile.
Absolutely. It's moving away from a one-size-fits-all approach.
So, connecting all this back for you, the listener,
Yeah.
what's the big picture? Diet is clearly a massive lever you can pull for managing high blood pressure.
Definitely. The DASH diet is well established, backed by lots of evidence, and a great strategy, especially when combined with lowering sodium. It's a solid recommendation.
But the research is evolving.
Yeah.
We're seeing these interesting studies on variations like the higher fat DASH or alternatives like VLC showing potential advantages, at least for certain groups or outcomes.
Right. It shows the science is dynamic. We're constantly learning more nuances.
And it's not just diet, right? The research we looked at reinforced other lifestyle factors too.
Oh, for sure. Weight loss came up repeatedly. The studies suggest, roughly, for every kilogram you lose, that's about 2.2 pounds, you might see your blood pressure drop by anywhere from, say, half a point to maybe even 2 points mmHg. It adds up.
That's a pretty good return on investment for weight loss.
Or what else?
Alcohol moderation.
Yeah.
Especially for heavier drinkers, cutting back can lead to noticeable drops in both systolic and diastolic pressure
Okay.
and physical activity, of course.
Yeah.
Regular exercise, aerobic, resistance training, even things like isometric exercises all contribute positively to lowering blood pressure according to the sources.
So it's really a package deal: diet, weight, activity, alcohol. Exactly. They all work together. And one final practical point that came up in the studies is adherence, actually sticking to these changes.
Yes, the real-world challenge.
Right. Many studies try to include behavioral support coaching, tracking, goal setting. Did it make a difference in the outcomes? The results were a bit mixed. For instance, in that VLC versus DASH study, the added behavioral support didn't seem to significantly boost the effects on BP or weight loss further, though it might have helped people stick to the diets generally.
So support helps with sticking to it, but maybe the diet itself is the main driver of the metabolic changes.
It could be. Other meta-analyses sometimes show support does help DASH lower systolic BP a bit more. It's probably complex, but the bottom line is making these changes stick requires effort and often some kind of support system. That's crucial for long-term success.
Okay, so wrapping up this deep dive, high blood pressure definitely a serious condition you need to manage.
But the good news is lifestyle, especially diet, is a cornerstone of that management. You have real power there.
The DASH diet is a proven, effective approach, well supported by research, particularly with that low sodium component.
Yeah, a very solid starting point.
But the research landscape is getting more nuanced, which is exciting. Studies on things like the higher fat DASH or the VLC comparison suggest that different dietary patterns might offer unique benefits, especially when tailored to specific groups, like those dealing with multiple conditions.
It really underscores that nutritional science isn't static, and maybe the future is about more personalized recommendations, moving beyond just one standard dietary script for everyone with high blood pressure.
So here's something for you to think about after listening. Given these varying effects, we're seeing how different diets impact not just blood pressure, but also things like blood sugar, weight, and lipids. How could understanding these nuances really help us tailor advice more precisely down the road, moving beyond that one-size-fits-all model?
It's a really interesting question for the future of managing hypertension and overall metabolic health.
Definitely something to mull over. If you found this deep dive valuable and want to keep up with what the studies are saying on key health topics, please do subscribe.
And if you know someone who's navigating high blood pressure or just interested in the science of diet, please share this with them. Thanks for joining us on What the Study Says.